Good morning. Today's topic is structure of shoulder. The shoulder is the most complex joint in the human body because it includes five separate articulations. The five separate articulations are sternoclavicular joint, acromioclavicular joint, coracoclavicular joint, glenohumeral joint, and scapulothoracic joint. So the first one is an sternoclavicular joint. So the proximal end of the clavicle that articulates with the clavicular notch of the manubrium of sternum and with the cartilage of the first rib to form an sternoclavicular joint. So this joint, it provides the major axis of rotation for movements of the clavicle and the scapula. A fibrocartilaginous articular disc that improves the fit of the articulating bone surfaces, and it serves as an shock absorber also. So the rotation that occurs in the sternoclavicular joint during the motions or the surging the shoulder, elevating the arm above the head and during swimming position, and this closely packed position for the sternoclavicular joint that occurs in the maximal shoulder elevation. This image, it clearly shows the sternoclavicular joint, that is the proximal end of the clavicle. That is, the clavicle has both the distal and the proximal end. In the proximal end of the clavicle, that it articulates with the clavicular notch of manubrium of the sternum, and it will attach with the first rib in order to form the sternoclavicular joint. Next articulation is an acromioclavicular joint. It is one of the irregular joint. It articulates between the acromion process of the scapula and the distal end of the clavicle. The rotation that occurs in the acromioclavicular joint during arm elevation only. The close packed position of acromioclavicular joint occurs when the humerus is abducted to 90 degree. So this irregular joint is otherwise called as an irregular diarthroreal joint. This image, it clearly shows the acromioclavicular joint that it is formed between the acromion process of the scapula and the distal end of the clavicle. And next articulation is the coracoclavicular joint. It is one of the syndesmosis joint. So syndesmosis means that slightly movable fibrous joint. So here the articulation is formed between the coracoid process of the scapula and the interior surface of the clavicle, and these are bound together by an coracoclavicular ligament. Here in this joint, it permits only an very little movement. So you can clearly view the coracoclavicular joint in this image. The fourth articulation is an glenohumeral joint. It is one of the most freely moving joint in the human body, that it enables the flexion, extension, hyperextension, abduction, adduction, medial and lateral rotation of the humerus. The glenoid fossa is less curved than the surface of the humeral head, that it enables the humerus to move linearly across the surface of the glenoid fossa in addition to that of the rotational capability. With passive rotation of the arm, here it is possible for the large translation of the humeral head and the glenoid fossa that is present at the extreme range of motion, and with the active rotation of the arm, it is possible that the muscle forces tend to limit the ranges of the motion. This image, it shows the glenohumeral joint with the glenohumeral ligament between the glenoid and the humerus, and one of the part here is an glenoid labrum. So this glenoid labrum is the perimeter of the glenoid fossa, that it is formed at the lip or labrum, that is composed of part of joint capsule the tendon of the long head of the biceps brachii and also in the glenohumeral ligament. Mm, this rim it have an dense collagenous tissue that it is usually triangular in cross section, and it is attached to the periphery of the fossa. The last articulation is an scapulothoracic joint because the scapula can move in both the planes, that is the sagittal and the frontal plane with respect to the trunk. So the region that is present between the anterior scapula and the thoracic wall is referred to as an scapulothoracic joint. So the muscle attaching to this scapula, it perform two functions. First function is that contract to stabilize the shoulder region. That is, for example, when an object is lifted from the floor, the levator scapula, trapezius and rhomboids that develop the tension in order to support the scapula, and the entire shoulder through the acromioclavicular joint will turn. And the second function is that the scapular muscle can facilitate the movement of upper extremity through appropriate position of the glenohumeral joint. And here it consists of an sac called as an Bursey sac. So it is an in this sac it secretes some synovial fluid internally, and so this fluid it will lessen the friction between the soft tissue around the joints, and also it provide cushion like structure so that it will reduce the friction between the layers of the collagenous tissues.